Yes, we need the 2 tests showing low testosterone levels, plus the person needs to be experiencing signs and symptoms that are associated with low testosterone. And these signs and symptoms can be quite the list. And this list includes physical signs and symptoms: reduced lean muscle mass, obesity, reduced energy and fatigue, reduced endurance, diminished work performance, diminished physical performance, loss of body hair, reduced beard growth. Cognitive signs and symptoms: depression, cognitive dysfunction, reduced motivation, poor concentration, poor memory, irritability. Sexual signs and symptoms: decreased libido and reduced erectile function. So as you can see, having even just a few of these signs and symptoms wouldn't be much fun at all. And it's also important for us to point out that if we go back to this list, that these signs and symptoms are not just exclusive to low testosterone. You could look at this list and say, man, I've experienced a handful of these signs and symptoms throughout my life. And so in other words, there are other potential causes to these signs and symptoms, and why it's also important for us to not just be all willy-nilly with giving people testosterone and just blaming all of our signs and symptoms on low T, if you will. But yes, it is justifiable if somebody meets the diagnostic criteria of those 2 low testosterone tests plus the signs and symptoms to initiate testosterone replacement therapy. But even then, it's still important to have clear expectations. And I do this with my patients